And so, hello and welcome, and please like us and let us know that you are listening now that we're
actually online.
Anyway.
So I'm plastic surgeon here at Bilalis Health and Beauty.
James.
And as a team, James Southwell-Keely, yes, we like to attend to all of our clients' needs, from top to bottom, inside to out.
Yes.
And we're talking about tight-toned skin tonight. And what we were rambling on before we realised that we weren't actually on air was just some of the things that clients can do at home, as well as an extension of that, what we can offer them here in the clinic. So why don't we jump straight into some of those great products?
So simple. Keep things simple. Good cleansing. Definitely some sunscreen. And we're going to talk about why. Perhaps some serums to help boost your cell renewal. But exfoliation as well. So
why is exfoliation so important?
Exfoliation, our skin keep producing cells, and as they come to the surface, they become flat and dull and dead. And when you're young, that process of exfoliation happens normally. But as we get older, unfortunately, that terrible world, that process slows down as well. So we want to normalize it by furthering or stimulating the skin a little bit more and help with that exfoliation. So
as we get older, we're holding on to those old cells for a little bit too long.
A little bit too long.
And the exfoliation just helps get rid of those.
Exactly. And if we don't exfoliate, then we look at the skin and it looks a little uneven, a little bit rough, a little bit pigmented, or
thicker, craggier.
Yeah.
It doesn't shine.
It doesn't shine. Yeah. It loses that glow that we all crave for so much.
So let's go straight to it. What's your favorite exfoliant?
My favorite is lactic acid. It's a gentle AHA. It exists in the body, so it does not irritate the skin. It can come in different strengths or concentrations. But from my experience, it has been very safe to use on pretty much everyone. So if you're a beginner, it's probably the best one to go for.
That's your entry-level exfoliant,
Definitely.
HAA treatment. HAA stands for?
Alpha hydroxy acid.
Alpha hydroxy acid. Can you get those in over-the-counter preparations, cosmetics? Or is it just the providence of cosmeceuticals and office-based treatments?
I'm pretty sure you can. To be honest, I haven't checked any recent cosmetic products, but I'm pretty sure you can. The problem would be probably not as effective because the percentage is lower, the concentration is lower, the pH is probably not enough to create a change. And of course, these products haven't been tested on humans in clinics and have clinical proofs. And that's what we talk about when we talk about cosmetic or cosmeceutical products.
So there's the cosmetic is where you buy the cosmetics in like Westfield or over the counter. In the makeup shop. Cosmeceutical we can provide you here in the clinic.
Here in the clinic.
And so that's a higher concentration.
Higher concentration and clinically proven.
Yeah.
And then of course there's pharmaceuticals.
And then the pharmaceutical, I guess, another level up again.
Yeah.
So we've talked about exfoliation and the alpha hydroxy acids. What about other treatments we can use for the skin?
Some of the treatments we do here, that we do here are obviously further alpha hydroxy pills here, so we can go from 25% to 50%.
Yep. How do you decide what sort of level you can go to with a client?
It really depends on the skin tolerance and what a client is after, whether it's to refine the pores or perhaps help brightening the complexion.
Acne scarring.
Acne scarring, you would really need to go quite higher. So again, it depends. Yeah, you need to go higher in your concentration, and it depends how deep the scarring is, whether it's just superficial or if it's pitted scarring, then we probably need to look at different modalities.
Yeah. So I guess this is something that I hear. A client will come and see me and they'll say, I don't want to know about any of that stuff because I've heard about people coming out with terrible rashes and blisters. I don't want any of those peels. I don't want any of those treatments.
Do you know when it all started? It started in one episode in Sex in the City.
Stop it. Really?
Yes, she did. She walked out and she was bright red, and after that nobody wanted to know about it because everybody thought they're going to end up like Samantha.
Yes.
Anyway, that is not the case anymore. There's certainly some treatments out there that you can have done by probably a cosmetic surgeon or have higher, maybe even laser resurfacing.
Yeah.
That will give you that kind of effect, which means, you know, a bit of downtime and need to recover, but
there's a whole spectrum of different concentrations available and different treatments.
And also different form of fruit acids.
Okay.
And they will cause different...
Could I have this done in my lunch break?
Absolutely.
There you go.
That takes 15 minutes, and even finishing with some sunscreen and minerals. So
sunscreen.
You'll be good to go. All
Absolutely.
Sunscreen.
So the
And
things
go
we do
with
here
that.
and the things that clients do at home, which is just as important. Getting plenty of sleep, drinking lots of water, taking time out to just reflect and relax. Sleep.
Sleep is
We all
important.
need sleep.
Alcohol is not great on the skin. Sugar is
It's
not
such a
great on the
shame.
skin. I know, it makes you feel so good. And then, you don't look so glowy the next day. So we need to look at that.
Yep.
Changing lifestyle altogether. But, and sunscreen. Sunscreen
in a country like this, absolutely. And all the different skin tones we have with all the different patient and sub-patient client people populations of this great land.
Yes.
Yeah, but
Really
everyone
important.
benefits from
Really
sunscreen.
important. Do we need to reapply it during the day?
Oh, absolutely. Even your 50 pluses, even the very high numbers, because it sweats off, it washes off.
Yeah.
And I mean, let's talk about skin aging. If we take a step back, because what we're trying to do oftentimes is unwind those negative effects of aging. So if we take that step back, one of the biggest aging effects of the skin comes from the sun, right? Solar radiation.
Absolutely.
So if we're going to try and unwind that, then if we can prevent it from happening in the first place, all the better. So let's pretend that we haven't been able to unwind it, or we've enjoyed too many days on the beach in the past. So now we've done our peels, our exfoliants, alpha hydroxy acids and beta hydroxys. What else can we do?
So with the chemical peels, we're treating the epidermis, the top layer of the skin.
Top layer of the skin.
Yeah, remember these cells mitose, renew themselves, get up to the surface and flake off. We're just taking care of that surface.
We're at the top level. What about if we go a bit deeper?
If we want to go deeper, we need to talk about collagen stimulation.
Where is the collagen in the skin?
So
top layer?
And the dermis.
Epidermis, and under
dermis
that
is the
dermis.
middle layer, and then we have
that's the real, that's
layer.
the engine room of the skin.
That's the engine. That's where all the action happens.
Okay, so what have we got in there? We've got the collagen.
We've got collagen and elastin fibers. We've got all our blood supplies. We've
nerve endings. We've got hyaluronic acid and all the glycosamine
hyaluronic acid. That's another thing that we seem to run out of production as we get older.
Yeah.
So that's another popular ingredients these days in anti-aging products.
It is, and you know what? There's a little bit of controversy, I believe, as to whether it can actually seep through the epidermis and the epidermodermal junction and get down deep, or whether it needs to come from below. So what are ways we can stimulate it from below? If we try our best to stimulate it from above or from the outside in, what are other ways that we can make our body reawaken and the production machine start pumping out more collagen and more elastin and more hyaluronic acid?
So within the clinic?
Yeah.
In the clinic we can use Omnilux.
Yes.
Omnilux helps with production of collagen, elastin and hyaluronic acid.
What is Omnilux?
Omnilux is a LED light machine.
LED.
LED.
Yeah.
It works anywhere between 630 nanometers to 830 nanometers. All that means is that it works in different layers.
Wide wavelengths, so they've got multitude of
and stimulates different
treatment
cells.
effects. Yep.
That's all we're doing. LED light
So
is
tap, wake up, come on, little Mr. Cell.
Buzz with energy.
Buzz with energy, keep going.
Remember what you need to do, so
Yeah.
get into action. Being a non-invasive treatment, you see an immediate effect. The skin looks nice and plump. The hyaluronic acid is boosted.
Yes. But I'm not going to be red like Samantha and
you're not. You're going to have. You're going to look probably as flushed as I look right now. So microcirculation, obviously increasing blood and lymphatic flow, and so that immediately gives you that glow. We love that.
Yeah, absolutely. Everybody loves that.
Yeah.
So instant effects, but also long lasting.
So it would only have a long-lasting effect if you have a course of treatments.
Repeat treatments.
So being non-invasive, we'll probably recommend anywhere between 6 to 10 treatments, depending if you combine it with your chemical peels.
Ah, yes. So multimodality treatment is always better than a single.
That's
Absolutely.
right. So if you combine it with a chemical peel, you're probably looking at about 6 consecutive treatments.
That's light treatment.
The
What about
chemical
ultrasound?
peel and light. That's
Together.
one option.
So that's a 1 + 1 = 3.
That's
Chemical peel plus light, the two effects together are greater than either one
great,
by
because
themselves.
then we're working on the surface as well as the dermis. So that's a great non-invasive
And if
treatment.
we want to take it even deeper in the dermis,
even deeper, that will
ultrasound.
be the ultrasound. Ultraformer with radio frequency.
So Lisa Rush,
Yes, she's our nurse, registered
practitioner
nurse,
here,
practitioner
fantastic, and she advocates for the use of the ultraformer. And so the ultraformer, I understand, is high intensity ultrasound energy, which is then going even deeper into the dermis and stimulating these cells that have become a bit lazy and a bit sleepy and waking them up again and getting them to produce all of the substance that goes to make up the skin.
That's it.
Give it the plumpness and the youthfulness that we're all aspiring
That
towards.
we're all looking for. There are other modalities available.
Let's talk about them.
We don't offer them here, but they are available, like skin. Oh, actually, the derma pen.
The derma pen, absolutely.
Yeah, Lisa does that as well. The
So how does
registered
that work?
nurse. That's very similar. It stimulates collagen synthesis in the skin by creating inflammation.
Yeah.
Right, so it's controlled. I can't talk too much about it because I don't actually do these treatments.
So it's a sharp needle, isn't it? It just penetrates the skin.
It does, and stimulates.
So you need topical local anaesthetic cream.
Yes, you do.
Yep. And you're a little bit red afterwards, but not terribly red.
Yes.
My understanding is that it's safe for all different pigment types, probably like the LED light treatment. Whereas some of the laser treatments, which are more invasive, can affect the pigment and the tone of certain pigmented skin types, which we don't want.
Reverse effect. Is that
Yeah.
what you mean? Yeah.
So we definitely don't want to first do no harm. That's how we operate, right?
We don't want that.
Do no harm.
We want to stay safe and make you feel good and relaxed.
Feel amazing.
And glowy.
So it's another treatment modality which stimulates the collagen. It does instigate a little inflammation, but in order to unwind the pre-existing inflammation and the slowing down of the skin.
Yeah.
It does allow also for the injecting or instilling of the hyaluronic acid.
Also further penetration
Into
of
the skin,
ingredients.
yeah, exactly, because you're making the microperforations and then you can instill the hyaluronic acid directly into the dermis.
Right.
Which is tough to get in otherwise.
Right.